Hello, good afternoon, friends. Today is the 20th birthday of my clinic. It is the second clinic. The first clinic before 4 years I have started. Before that, the first clinic. So nearly about 30 years I have completed in my practice. And this clinic at the Indira Nagar I started on the 20th of August in 1995. So it's a big Huawei which developed. And during this whole um, learning, practicing, all those things, a number of experiences have happened. And that's why today I have considered one more remedy to share with you by explaining one nice case. It's a case of nearly about the 45 years, 46 years female professor. In fact, she was a professor in Mumbai University, and she was a very good orator. 2 years before coming to me, she had a tumor on her larynx. She started getting hoarseness of voice, and she was diagnosed it is a malignancy. She was operated with laser, and they have given the chemotherapy to her. 2 years before, just 1 year prior to it, she has started a dysfunctional uterine bleeding, a severe bleeding with a typical hot flushes, a climacteric change which was happening earlier in her life, and the hysterectomy was performed before that. So it was started with DUB, followed by hysterectomy, followed by a laryngeal tumor treated with laser therapy with a chemotherapy, and she again started delivering lecture in her university, and she was a good teacher, and again developed a hoarseness after 1.5 years. So one of my friend was her friend. So he asked her to meet me regarding it. And she right from Mumbai, she came to Sangamner for her problem. It was late in the evening. I took her case. It was nearly about 1.5 hours. Good communication, but during consultation, whenever she used to talk, it was hoarseness off and on. The voice was coming up and down with a lot of hawking over there. When it has recurred, she was shown to the same doctor who has done the laser treatment, and he asked that she has to go for biopsy again. And he said that it might be a recurrence of the same malignancy, and you have to go for another chemotherapy setting again. And because of that, she came to me directly and she said that I want to avoid all those things. So whether homeopathy can do anything. She was having a cough, and that cough with a severe rattling, and whenever she has to talk, the cough was disturbing her. And so whenever she used to utter any answer, or whenever put any question, she does one thing. This is the hem and hawk. This was quite common every time she was answering. And then she tries hard to talk loudly, because sometimes her sound was getting down. So this was the problem with her. So it was very clear for me, two three important things which I have observed. She was regularly a public speaker. The presentation with which she came to me, she was very nicely dressed. She was having a typical ornaments all over body, a good looking, in fact, a good personality, and a very good politeness in her speaking. So there was only a single thought about the remedy, about the Argentum Metallicum. and I have kept her on Argentum Metallicum in directly on LM in LM potency in repeated. So I have started the Argentum Metallicum right from the first potency LM1, and every month I have increased the potency because the remedy remains to be the same during the follow-ups also. She used to give me a follow-ups every month, and after 4 months of treatment, she again consulted same surgeon. He again re-examined her, had done the laryngoscopy, and he said, now there is no more growth. And he declared that there is no need to retake the biopsy, which I have said 4 months back. And then he asked, what you have done? She said, I have started treatment with the homeopathy in Sangamner, and this is the result. Her all symptoms disappeared under the action of this remedy, Argentum Metallicum. So it was a good case to learn, and it recurrence of the malignancy recovered with the Argentum Metallicum. It itself suggests that this remedy has a depth. In fact, any remedy from the metals are always a deep acting remedy. So you have to understand the core of the remedy. So why not to learn it from Alan's keynotes? So let us go ahead what Alan says regarding this remedy, and we'll learn few more things about this metal, the Argentum Metallicum. It is a pure silver. The personality, see the constitution, tall, thin, irritable persons. Elements from abuse of mercury. This word comes again and again. Abuse of mercury, this terminology, number of people doesn't understand why the mercury is written over there. It was the only treatment earlier for the syphilis. Local preparations of mercury they used to give, and that used to produce a secondary syphilis or syphilitic miasm in the patient, expressing internally. So you get it in heparsulfuricum, you get it in even in mercurius, you get it in uh, this remedy, that is the Argentum Metallicum, bad effects of or abuse of mercury. So it means that mercury was prescribed earlier for syphilitic purpose, and then secondary features of the miasm developed. So this is abuse of mercury. Constitutional effects of onanism. What is the onanism? Onanism means sexual debauchery, sexual thoughts, sexuality. So constitutional effects, the effects which are related with the sexual problems. That is the basic problem. That syphilis is contracted because of all those things. So a constitutional effects of the onanism, the seminal emissions in case of males after onanism almost every night without erection with the atrophy of the penis. See the pathological effects in the males. This is the pathology which happens to be there in the at the level of sexual sphere. The atrophy of the penis with the without erection. There are seminal emissions. At the seminal emissions after the lot of sexual thinking almost every night. So this is one more remedy one should think always in whenever you think about the sexual remedy. Then the crushed pain in the testicles, like rhododendron. So severe pain in the testicles, and is as if someone is crushing that. That type of problem is there. Prolapsus. Yes, it is a very important remedy for the prolapsus of uterus, with pain in left ovary and back, extending forward and downward. Exactly opposite is the palladium. In palladium, it is the right ovary. You can get it in right ovary. The similar pain you can get in left ovary, Argentum Metallicum. One more remedy you should not forget is the thuja, is left-sided ovarian pains. Right-sided ovarian pains, along with palladium, lycopodium is one more remedy. Prolapsus with a climacteric hemorrhage. Yes, that was there with that case. Climacteric hemorrhages. So this is one remedy one should not forget in the prolapsus with climacteric problems, climacteric hemorrhage. Exhausting fluent coryza with sneezing. That is the Argentum future. That exhaust severe type of coryza which is causing a lot of sneezing and exhaustion. Hoarseness of professional singers. Underline this. This is very important. Hoarseness of professional singers, public speakers, The two more remedies mentioned over there is alumina and arum tripalum. But I suggest that this is the only remedy which generally requires for this. Even heparsulf is also mentioned, but this remedy does the wonder. I have heard a story of Balgandharva who had treated by some homeopath, and he was having a program on that day, and he was having severe hoarseness and it was not possible for him to perform. And then he visited a homeopath and he said that today evening I will be there to listen you. And really he recovered within 4 to 6 hours with the help of Argentum Metallicum. This is the story which I have heard. I don't know the reality, but this is a story I have heard from someone else. Total loss of voice with the professional singers, and this is because of laryngitis. The inflammation of a larynx, either because of some pathology or it is simple laryngitis, which is used to produce a typical loss of voice. Throat and larynx feels raw and sore on swallowing or on coughing. So whenever they used to swallow, whenever they used to cough, there is always a raw sensation. It is in the larynx. If it is in the pharynx, we have discussed the remedy on that day. That is the ischilus, which we have discussed on that day. Laughing excites the cough. This is very important. The remedy, the stannum, the drosera, the phosphorus, these are the remedies whenever the laughs, the cough is excited and produces profuse mucus in the larynx. So there is a laryngeal secretions which happens over there in this remedy. In case of aeschylus, it is the pharyngeal secretions which happens to be there. When reading aloud has to hem and haw, cup with easy expectoration of the gelatinous viscid mucus, looking like a boiled starch, and that type of expectoration is there, as if a boiled starch, that is, or as if a white part of an egg, that typical specific type of secretions which you can get in Argentum Metallicum. And they generally they talks like that. They whenever you ask the question, this is the way they start talking. Whenever you get this, you first think of Argentum Metallicum, Argentum nitricum, Heparsulfuricum, Lachesis. These are the remedies which have this type of irritation in the larynx or pharynx. Great weakness of the chest. Yes, that is Stannum Metallicum. But sternum is difficult. It is very difficult for sternum to talk. That is basically a severe weakness in the chest. That is a breathlessness which develops in sternum, and that exhaustion which you can get in sternum metallica. Great weakness of the chest, especially worse on the left side. This is the remedy in Argentum Metallicum. Alteration in timbre of voice with the singers and public speakers. So, timbre, what is timbre? That is a tone which has been volume. Sometimes it comes up, sometimes it the curve comes down. It is because the larynx is inflamed. Sometimes it vibrates properly. Sometimes it never vibrates properly, and that's why the tone changes over there. So this is very specific symptom of this Argentum metallicum and arum triphyllum. Then raw spot over the bifurcation of a trachea, worse when using the voice and talking or singing. And they talks. This is the point where I used to get the problem. That shows the typical site where that is the tracheal bifurcation. That itself is responsible to produce an irritation inside the chest. Sometimes the curve, sometimes they gets excited and there is a lot of mucus which comes out. They wants to clear the throat and then they talks to you. So this is very typical with the Argentum Metallicum. Very specific action on the larynx. One should not forget this remedy. So laryngeal pathology, first think of the Argentum Metallicum. So these thoughts should come in your mind. There is one more remedy which we have discussed already is the polyphus, where you can get typical features like this, urgent like hoarseness, which is acute hoarseness of the voice, which develops over there. Relations follows well after the alumina, very similar to the sternum in cup excited by laughing that already we have discussed. But sternum has a tremendous weakness, especially that is the respiratory weakness which you can get in sternum metallicum. Sternum is a very deep acting remedy specifically for geriatric age. That is a very important remedy in old age. Aggravation, riding in a carriage like cocculus, So whenever they travels, they gets a problem. So this is very common to the cocculus. When touched, aggravation when touched or aggravated on or pressed upon, aggravation by talking, aggravation by singing, aggravation by reading aloud. So whenever they try to use their voice, the aggravation happens to be there. So this Argentum Metallicum remedy, which is depicting remedy having a syphilitic background. So psychosyphilitic miasm is in background. You can consider with the pathologies when those are related basically with the larynx and laryngeal problems. So never forget this remedy. This is very useful remedy in your practice. Whenever patient comes with severe hoarseness, give that remedy and find it out the result. And patient is happy after 3 4 days. Doctor, you have given me the remedy and it worked very nicely. So this is a prize giving remedy in your practice. Don't forget that remedy. Thank you, Amit. You are there. Then Harshal. Then Dr. Prajakta. Then Dr. Sunil. Sunil, good afternoon. After long time meeting you. So thank you being there. There was one question, sir. Did you increase the LM potency every month? Yes. Generally, I used to increase the LM whenever I start the LM and if patient's condition or patient state remains the same. I used to change it every month. For first month, if I start with the first, then second, third, fourth. If today I have given one LM 11 directly, so I have started with LM 11, then I will start with further follow-ups. I will give the LM 12, 13, etc. every month. So I used to increase the potency every month. So, and second important thing, whenever you are using the LM potencies, try to simplify the method of providing that remedy. It is not always that you should follow what is given in the books because it should be comfortable. Then patient takes it. Otherwise, they refuses. So that's why you make your own method. It doesn't matter how to give that remedy. I used to give it in whenever I used to send the courier. I used to prepare 30 doses of the potency. I used to ask them that dissolve that in 50 or 100 ml of water and consume that water in a whole day. And what I used to ask them every time whenever they are consuming that, give the 10 succussions to that so that it will be energized again and again. So this is the way I used to prescribe it. So thank you very much being there. Tomorrow we'll meet with some more remedy. Thanks a lot.